Mr. President, I rise today to join my colleagues in opposing Congressman Tom Price's nomination to be the Secretary of the Department of Health and Human Services. Every American deserves the opportunity to have quality, affordable health insurance coverage to help them live healthy and productive lives. And having health care is not just critical to the freedom, dignity, and well-being of our citizens, but also to the strength of our economy. As governor, I worked with Democrats and Republicans in New Hampshire to expand health insurance coverage, including coverage for substance use disorder and behavioral health services, to tens of thousands of Granite Staters. We need to bring this same bipartisan approach to the Senate. We know that there are serious challenges in our healthcare system that must be fixed, and we need to work across party lines to support common sense improvements to move our nation's healthcare system forward, not rip health insurance coverage away from millions of Americans. Mr. President, this is why I cannot support Congressman Price's nomination. Throughout his time in office, Congressman Price has promoted policies that would undermine the health care that so many in my state and across our nation depend on. Congressman Price wants to repeal the Affordable Care Act, which would strip coverage away from millions of Americans. Those who seek to repeal the ACA, including Congressman Price, have not come up with a plan to replace it. Repealing the ACA without a replacement would send insurance markets reeling. It would be devastating for millions of people who have coverage because of the law. Repealing the ACA would eliminate New Hampshire's bipartisan Medicaid expansion plan, harming our state's efforts to combat the heroin, fentanyl, and opioid crisis. This crisis is the most pressing public health and public safety challenge facing our state, and thousands of Granite Staters have accessed substance misuse treatment because of Medicaid expansion. Just a couple of weeks ago, I met a young man named Noah at Harbor Homes in Nashua. Noah is an active participant in the Nashua Drug Court and a former enrollee in our Medicaid expansion program. Last month, after 14 years of struggling with addiction, Noah was celebrating 1 year sober. Because of legislation that expanded Medicaid, passed under bipartisan leadership, Noah received health insurance through Medicaid expansion, and he was able to quickly begin treatment. Noah's recovery process required medication-assisted treatment, which he would not have been able to afford had it not been covered under Medicaid. He's now 5 months off the treatment and hasn't had an instance of relapse. Noah said that the ACA and Medicaid expansion are, quote, working miracles every single day in this recovery community. For Noah and so many others, we cannot afford a setback. But that's what the repeal of the ACA would do. I also oppose Congressman Price because he's determined to turn back the clock on women's access to reproductive health care. He has fought against a woman's constitutionally protected right to make her own health care decisions and control her own destiny. He has voted 10 times to defund Planned Parenthood, and he has voted against a resolution to protect employees from being punished or fired by their employers for their reproductive health decisions. And I oppose Congressman Price because he has pushed to turn Medicare into a voucher program, which will increase costs for seniors. Congressman Price's views and priorities are simply at odds and out of touch with the views and priorities of many, many Granite Staters. Additionally, Mr. President, serious issues have been raised throughout this nomination process regarding Congressman Price's conflicts of interest and his potential violation of the Stock Act, including recent reports suggesting that he received a private discount to purchase a health company's stock while engaged in legislative efforts that would directly affect the company's financial interests. Congressman Price's insufficient responses concerning his stock purchases raised the question of whether, if confirmed, he will put corporate interests ahead of the American people. That's unacceptable. I believe we need a healthcare system that works for every American, and that is why I will vote against Congressman Price's confirmation. I want to talk a little bit more about what Congressman Price's confirmation would do with respect to Medicaid expansion, and particularly in how it would affect the opioid crisis in New Hampshire. In New Hampshire, we proved that Democrats and Republicans can come together to move our healthcare system forward when we passed our bipartisan Medicaid expansion program. Passing and reauthorizing this program included healthy debate and at times some argument. But what matters, of course, is what we do after our arguments, after those debates. And we were able in New Hampshire to put our differences aside and take a critical step forward to continue strengthening our families, our businesses, and our economy. This is the approach we need to be taking in the United States Senate. Benefits of Medicaid expansion are clear. Over 50,000 Granite Staters are now covered in a population of 1.3 million people. We included in Medicaid expansion coverage of substance use disorder and behavioral health services. And I have heard story after story of Granite Staters who are in recovery thanks to Medicaid expansion. I told Noah's story just a few minutes ago. At another roundtable, I met a young woman named Ashley at the Farnham Center in Manchester. Ashley told of suffering from addiction for over 10 years. One day she woke up to discover that her husband had died of an overdose. She lost custody of her young daughter. But because of Medicaid expansion, Ashley was able to get treatment. She's been in recovery now for a little bit over a year. Recovery through medical treatment made possible by Medicaid expansion. Because she is in recovery, she was able to get a job. Because she began working again, she actually has now moved off Medicaid expansion onto private health insurance. So Medicaid expansion was there when she needed it to get healthy. Now she doesn't need it anymore, and she is participating in the private health insurance market. And by the way, she is beginning to reestablish her relationship with her young son. That's the power of the Affordable Care Act. That's the power of Medicaid expansion. Representative Price, on the other hand, has advocated for repeal of these very programs. And such a repeal would have such harmful impacts, pulling the rug out from those who have coverage right now for critical medical conditions. At his confirmation hearing, Representative Price declined to guarantee that Americans with substance use disorders who've gotten insurance through Medicaid expansion would still be covered for these services if the Affordable Care Act is repealed under Representative Price's leadership. He also would not commit to continuing the requirement under the Affordable Care Act that health insurance companies must cover essential health benefits, including treatment for substance abuse. Representative Price's support for the repeal of the Affordable Care Act also requires more discussion. The Affordable Care Act has helped families across our nation access quality, affordable health insurance coverage. We need to come together now and find bipartisan areas in which we can agree to improve the law. But we should not be repealing it. We should not be taking coverage away from millions of people. I have joined a number of my colleagues in expressing our willingness to work across the aisle with our colleagues to improve the law. But unfortunately, it seems that our colleagues here in the Senate are headed down a path to repeal the law without a plan to replace it. Repealing the ACA without any replacement is a recipe for upheaval and instability, a recipe for hurting our families, small businesses, and our economic progress. Representative Price and those who seek to repeal this law have not agreed on any path forward other than repealing and stripping coverage away from millions of Americans. Repeal would have major consequences for many Granite State families and small businesses, and my office has heard from constituents about the impact that the Affordable Care Act has had on their lives. One resident from Keene, New Hampshire, wrote to say that this law has helped fulfill his goal of starting a new small business. He wrote, and this is a quote, "I've had health insurance through the exchange under the ACA since late 2015, when I quit my job to start up a business. Before the ACA, I wouldn't have taken the risk to start a business because I have a pre-existing condition, and I wouldn't have been able to get an individual health insurance policy." He continued, "Under the ACA, I am able to get good health insurance at an affordable premium. Since I left my job, I've built up a profitable business and expect to be in the position to hire employees within a year or two. None of this would have been possible without the ACA." And he added, quote, "If the ACA is repealed, I'm concerned that I'd need to put my business on hold in order to go back to a corporate job that I don't need, only to get the health care benefits. The ACA has flaws, but overall it's allowed me to take an entrepreneurial risk and start a small, successful business." Mr. President, it is clear that this law has truly made a difference, not just for the health of our citizens, but also for our economy. And we cannot undermine the progress we have made. I am also deeply concerned about Representative Price's record and his statements concerning women's health care. Representative Price has consistently opposed women's reproductive freedom. I have always fought to protect a woman's right to make her own health care decisions and to chart her own course, and I always will. This is not just a matter of individual freedom, which of course is a good enough reason in its own right to support women's reproductive choice, but it is also a matter of economics. When women have to pay more for their health care than men do, it puts them at a financial disadvantage. As governor, I restored family planning funds and pushed to restore state funding to Planned Parenthood, because I know how critical these services are for the women and families of my state. It is unacceptable that Washington Republicans continue to play games with women's health, and Representative Price has been at the forefront of that effort. Representative Price does not support a woman's constitutionally protected right to a safe and legal abortion. He has co-sponsored and repeatedly voted for measures that would ban all medically appropriate abortions without exceptions for rape, incest, or to protect a woman's health. He has voted to penalize small businesses that choose private health plans that include abortion coverage. Additionally, he has voted to allow employers to discriminate against employees based on their reproductive health decisions. He voted to eliminate the Title X family planning program. He voted 10 times to defund Planned Parenthood. Defunding Planned Parenthood, a critical health provider, would have devastating effects. A recent article in the Washington Post highlighted the impacts of what can happen when legislatures attempt to defund Planned Parenthood. This report in the Post found, and here's a quote, in 2011, the Texas legislature cut the 2-year budget for funding family planning from $111 million to $38 million in an effort to defund Planned Parenthood. After these cuts, 82 Texas family planning clinics, 1 out of every 4 in the state, closed or stopped providing family planning services. An unintended consequence of the law was that 2/3 of the clinics that closed were not even Planned Parenthood clinics. The quote continues, organizations that remained open, many with reduced hours, were often unable to offer the most effective methods of contraception, such as IUDs and contraceptive implants, to women who wanted them. The closings and reduced hours also eliminated or cut back access to primary care providers for a significant number of women. Mr. President, women and their families deserve better than an HHS secretary who would disregard their constitutional right and roll back their access to reproductive health care. They deserve better than an HHS secretary who appears to believe that women are neither capable nor trusted to make their own health care decisions. I believe women should be full and free citizens in the United States of America and can be trusted to make their own health care decisions. And Representative Price's nomination and his confirmation would be harmful to our seniors as well. Seniors deserve a high quality of life, high quality care, and access to the benefits that they have earned throughout their life. And I believe we must continue to strengthen and protect Medicare for years to come, not undermine it. Unfortunately, Representative Price has long sought to undermine Medicare and the important benefits it provides to seniors. His budget proposals have included extreme cuts to the program. He supports turning Medicare into a voucher program. In fact, he even said he wants to voucherize Medicare within the first 6 to 8 months of the Trump administration. This would increase costs for seniors. He has also repeatedly opposed allowing Medicare to negotiate drug prices for seniors. He's argued that seniors have no drug cost problem. Imagine that. A Health and Human Services secretary who believes that drug costs are not an issue for our seniors. He even said allowing Medicare to negotiate prices for prescription drugs would be a quote, and this is his quote, a solution in search of a problem. I can tell Representative Price that there are certainly seniors in New Hampshire who have found that the cost of their prescription drugs are truly a problem. And as we talk about the need to shore up and strengthen the Medicare program, one of the best ways to stabilize its finances would be to allow Medicare to negotiate for prescription drug prices, to lower those prices, lower the costs of the program while making the program even more affordable for our seniors. That's not something that Representative Price has even expressed a willingness to consider because he doesn't even acknowledge that there's a problem. And Representative Price has also supported raising the Medicare age from 65 to 67. This amounts to a devastating benefit cut for seniors, shifting cost burdens onto them, which is unacceptable. Whenever I hear people suggesting raising the retirement age for Social Security or the age for Medicare eligibility, I am reminded of my father-in-law. My father-in-law, Vin, was one of the hardest working people I ever knew. He worked as a wholesale meat cutter. And for anybody who's never seen what that means, it means standing on your feet for hours at a time in a cold meat locker as large carcasses come through, and with time pressures the way any production facility has, cutting those carcasses into saleable product. My father-in-law left the house before dark. He often came home, having been assigned overtime after dark, standing on his feet in the cold, doing incredibly hard physical labor. When it came time for him to retire, when he became eligible for Medicare, he really couldn't have worked at that job much longer. And the fact that he had a dignified retirement after those years of hard work was in large part due to Medicare. And before the physical impacts of that job slowed him down, it was our great pleasure to watch a man who had provided for his family with such hard work know the dignity of playing with his grandchildren, sleeping in till 7:30 or 8 in the morning, and watching his family grow and strengthen and thrive. That's the dignity of Medicare. It's the dignity of Social Security. And to have a Health and Human Services secretary who believes we should just be raising that age, as Representative Price does, contradicts the very notion of what it means to earn a benefit and to know a dignified retirement. Mr. President, I am proud of the progress we've made to help ensure that more Granite Staters and Americans have the quality health care that they need at an affordable cost. There is much more work to do to move our health care system forward and to combat the heroin, opioid, and fentanyl crisis that has devastated far too many families in New Hampshire and across our nation. And I am ready and willing to work with anyone who is serious about making improvements to our healthcare system to improve affordability and access to care. But that does not start with pulling the rug out from millions of Americans. It does not start with rolling back women's access to critical healthcare services. Congressman Price's record demonstrates that he puts a partisan agenda and corporate interests before the health and economic well-being of our families. Mr. President, the American people deserve a Secretary of Health and Human Services who will help more Americans receive quality, affordable health insurance coverage, not one who supports stripping it away by repealing the Affordable Care Act without a replacement. For these reasons, I will be voting no on Congressman Price's nomination, and I urge my colleagues to do the same. Mr. President, I suggest the absence of a quorum. Thank you.
Clerk will call the roll.